Okay, hello, my name is Heath Kao, and today I'll be presenting my business model canvas analysis focused on the adoption of advanced technologies, specifically large language models uh, or LLMs, in a healthcare setting. This presentation explores why advanced technology adoption matters, the operational bottlenecks healthcare organizations face today, and how large language models can support more efficient patient-centered care. Um, while working as a registered nurse in a hospital setting, I've observed a major operational bottleneck related to clinical documentation. Even though most documentation today is electronic, nurses still perform a large amount of manual and repetitive charting within electronic health record systems, and clinicians, often have to re-enter and summarize the same information across multiple sections, such as narrative notes, flow sheets, care plans, and handoff tools. And this documentation burden consumes significant time and cognitive effort in fast-paced and high-stress clinical environments. As a result, time spent on charting can reduce the time available for direct patient care and clinical decision making, highlighting the need for more intelligent and automated solutions. To address this challenge, I propose implementing advanced AI technology, specifically large language models. Um, The large language models are capable of understanding and generating human language, allow them to synthesize clinical information and support documentation tasks more efficiently. Unlike traditional IT system, the LLMs can be applied across both clinical and operational domains, supporting documentation, patient communication, decision support, and administrative automation. In addition, LLMs can enhance staff training and improve patient understanding by translating complex medical information into a clear, readable language. Overall, this technology enables a shift from manual, error-prone documentation toward more proactive and data-driven workflows. Mm, this slide explains the linkage between the business model canvas and business architecture. According to Oster, Water, and Pickneur, the business model canvas is a strategic tool used to visualize how an organization creates and delivers value. It works well for high-level planning, but it doesn't fully explain how complex technologies are integrated into daily operations. And building on that, Nagarajan col and colleagues suggest that smaller organizations benefit from adopting new technologies through gradual out of the box approaches rather than large disruptive implementations. And based on these ideas, I connect the business model canvas with business architecture, which focuses on capabilities, workflows, and information assets. This combined approach helps ensure that large language models are adopted in a way that is practical, scalable, and resilient. The value proposition of this model is to improve care quality and patient safety by reducing documentation burden and supporting better clinical decision making. By enabling clinicians to spend more time on patient care, the organization can increase patient satisfaction while strengthening its overall competitive position. There are several key stakeholders benefits from this models. Clinical trainees gain faster learning, first of all, and improved clinical reasoning through low risk simulations and case-based training. For current staff, large language models reduce repetitive documentation, allowing clinicians to focus more on decision making and patient care while reducing burnout. Healthcare organizations and insurers benefit from more accurate documentation, improved training consistency, and greater operational efficiency. And patients also benefit through improved uh, health literacy, uh, multilingual support, and clearer explanations of care plans, medications, um, better understanding of their current status, conditions, discharge interactions, etc. In terms of cost structure, automation reduces reliance on manual labor, allowing the organization to reinvest savings into AI vendors. I mean, not AI vendors, AI subscriptions and data training through outcome-based pricing models. From a resource perspective, the organization transitions from human labor as its primary access to data assets, including proprietary EHR data, and pre-trained biomedical models. Mm, for key partners, successful implementation of advanced AI technologies requires strong partnerships with AI vendors and technology providers. These partners support continuous model updates, data training, system security, and interoperability interoperability with existing healthcare systems. Such collaborations help ensure that the technology remains compliant, stable, scalable, and aligned with clinical and operational needs. From a revenue perspective, improved documentation accuracy and care quality can support higher reimbursement and performance based incentives. At the same time, operational efficiencies and reduced administrative burden can help lower cost, strengthening the organization's overall financial sustainability. Mm, oh, my bad. For customer relationships, with AI supported workflows, patient relationships can shift from largely transactional uh, interactions to more participatory and personalized care experiences. Patients become more engaged through clearer communications, improve understanding of their care plans, and ongoing informational support. Uh, for distribution channels, the large language models enable conversational interfaces that allow staff to access information, generate documentation, and communicate more efficiently. And this reduces reliance on manual handoffs and physical document movement, enabling faster and more seamless information flow across teams. For customer segments, the primary customer segment includes hospital patients, particularly those with limited health literacy or access to care. The model also supports multilingual, multilingual, lingual and underserved populations by providing clearer, more accessible health information and documentation. Conceptual design for this slide, the effective adoption of large language model requires a shift from traditional rigid software systems to conversational and generative interfaces. The conceptual design centers on patient experience by transforming complex clinical information into actionable and understandable insights. This enables more proactive, data-driven care delivery models that improve both patient and engagement of and quality outcomes. And in conclusion, um, while full implementation of large language models may take several years, over 5 years, I think, uh, early strategic planning can position healthcare organizations for long-term scalability without uh, proportional increases in labor costs. Um, Clinical workflows can shift from resource-intensive processes to more efficient data-driven systems. However, as discussed by Mighty and Satya in 2025, ongoing attention to data diversity, governance, and human oversight is essential to reduce bias and avoid automation bias that could undermine political judgment. When implemented responsibly, large language models can enhance care quality, improve patient engagement, and significantly reduce administrative burden. All right, here are my references, and thank you so much for listening.